this week, we're focusing on your health with Florida cancer specialist. Today, I'm joined by Jared Sokol, Dr. Jared Sokol. He joins us with the latest advances in radiation technology for oncology. Now, obviously, that's a mouthful, as you tried to hear me say there. But Dr. Sokol, what are some of the advances? Because you hear people talk about that often, that there are new things in cancer treatments, but specifically radiology.
Well, particularly radiation oncology. I wish I had an hour to tell you all the exciting things, but unfortunately I don't. So we'll begin with the big ones. You know, the first one, I think, the big advance, is that we really are able to focus radiation on specific tumors and eliminate them. And eliminate the tumors and actually eliminate the surgeons. Lung cancer, small tumors, we could expunge with no surgery, and literally the patient will walk out of the office unperturbed completely. Brain tumors expunged radiotherapeutically. So now we have the operational ability radiotherapeutically with computerization technology, nanotechnology, to focus on a tumor and get rid of it. And you pick your spot, whether it's the eyeball, the pancreas, the liver, the brain, we can do it.
I feel like when someone gets a cancer diagnosis, I always find myself wondering, are they going to have to go through chemotherapy? Are they going to have to go through radiation? And so what are the cancers that are best suited for this kind of radiation that you're talking about?
Well, I have to tell you something what I tell patients constantly. Oncology is expanding with such unbelievable growth rate that it's impossible for a medical oncologist or a radiation to embrace it all. So when you ask a question like that, my advice is make sure the patient, even if they're not specifically directed, to see the radiation oncologist, the medical oncologist, and the surgeon even before they give treatment. We have a residency program at our hospital. We ask the residents, pick a tumor that we can't treat radiotherapeutically, and they can't do it. Because basically, under the right circumstances, the right patient, we can basically treat everything as long as we direct it in the appropriate fashion, as you've heard before today.
Yeah, well, you know, one of the things in Florida that you hear a lot of is skin cancer because of the sun, and people want to have the nice glow of skin. Is this something, I mean, skin cancer can be in all different areas, so how do you kind of balance the radiation treatment there?
Well, it's really, to us, there really isn't a balance, because we believe that 90 or 95% of skin cancers, mostly non-melanoma, but the common ones, squamous and basal cell, we can cure 90 to 95% with no surgery, with no bleeding, with no infection, with almost minimal scarring, so you could barely tell. And we do this routinely now.
Well, you've talked about all of the advances that you've seen, that you're excited about. What about the future? Where's the radiation going in the future for the treatment of cancer?
Well, like most things in oncology, it's all molecular biology. It's all understanding how the basic genomics of cancer works. And as we learn more about that with drugs and with patterns of growth of cancer, we're learning how radiation affects the immunology, as you've heard from Dr. Wenck, how it affects the basic immunology of cancer, and radiation does that too. And we're now looking at radiation therapy not just as a ablative, but as an immunotherapeutic modality of treatment.
Whew, that's a mouthful, but I've got to say you do a very nice job of explaining it. So thank you so much for coming on to talk about the new and the exciting treatments that are going on right now. We appreciate your time. And if you'd like to learn more about survivorship, living with cancer, well, the Florida Cancer Specialists are here to help. Just log on to their website at flcancer.com.